Modern medicine has been a guiding light for many people in the nation. However, there's one group that's been left in the dark for long, the Native American population. From diagnoses to healthcare facilities, tribal lands are struggling to find healing and help within our nation's healthcare system. Lauren Davis tells us how the MHA Nation is improving the healthcare themselves for its tribal members.
According to a report by the First Nations Development Institute, 54% of American Indians and Alaska Natives live in rural or small town areas. In many rural areas, residents may find it hard to access the health care that they need. But on the Fort Berthold Reservation, changes are being made to ensure that residents have access to health care.
We have to travel up to hour and a half, 2 hours to get healthcare services. So that's why we do our best to bring the services to our community members.
The Elbow Woods Memorial Health Center opened in October of 2011. The center offers a variety of health services for people who are enrolled members of federally recognized tribes.
Primary care. We do have some specialty care in the form of sports medicine, orthopedics, as well as podiatry. We also have a dental program.
The health center also has field clinics in White Shield, Parshall, Mandaree, and Twin Buttes. The most recent addition to the tribal healthcare system is the Diabetes Center, which was opened earlier this year. According to the CDC, Native Americans have a greater chance of having diabetes than any other racial group. And diabetes is a common cause of kidney failure, which is why the center practices intervention, treatment, and prevention.
Once you're treating someone for a condition, you're already behind. So prevention is actually the gold standard, is where we should be going for medicine. Right now, we've been doing treatment. We've been treating people, and that is not working because nothing's changed. So we need to refocus our effort.
Having easy access to healthcare is important for every single community. It could even save a life.
We know that as American Indians and Alaska Natives, we're usually diagnosed later with poor outcomes of a variety of illnesses, from diabetes to cancers to other chronic care conditions. Whereas if you're in the community, and people are more likely to access our health centers if they're right there in our community.
For generations, Native Americans have taken matters into their own hands in terms of healthcare. When help was too far away, they built their own hope within the walls of the community. That's why Indigenous healthcare is so important to so many North Dakotans. For KX News, I'm Lauren Davis.
The Indian Health Service, an agency within the U.S. Department of Health and Human Services, provides care to more than 2 million Native Americans across the country. Although it fulfills treaty responsibilities to provide health care for members of more than 560 recognized tribes, Congress has consistently underfunded the agency, forcing hospital administrators to limit the services offered. It's a problem tribal lands in our state face every day.